Hi there, Dave Munday here, Lead Professional Officer with Unite, the union in the health sector. Just wanted to do a quick video about the conference that we've been at for the last few days. Myself and Julia Mikardo, who is one of our Applied Psychology Organising Professional Committee members at Unite. We've both been up in Glasgow Friday, Saturday and Sunday at the Association of Child Psychotherapists conference. It's been great to be here, and we just thought we'd share a few messages from the event. Now, Julia, you're our Association of Child Psychotherapy rep on the Applied Psychology Organising Professional Committee. What does that entail?
Well, I'm one of two national reps from the ACP, and it means that child psychotherapy has a place at the table along with our psychology colleagues strategically to meet 4 times a year to discuss causes of interest in terms of terms and conditions for our members, the role of psychology and child psychotherapy professions within the NHS, to think about campaigning issues in terms of mental health generically and how our professions can contribute and make sure that we continue to be core members of services that are so desperately needed around the country.
And obviously the last few days we've met with lots of child psychotherapists from across the UK. What would you say are some of the big messages that they've been talking about?
Well, they worry about obviously resourcing of their services, that we can actually meet the needs, growing and increasing needs that we know are there for children and young people across the country in terms of mental health, unmet need. Our role in CAM services, specialist CAM services in hospital provision, paediatrics, in under 5 services, in specialist looked after children's services, and a range of other services trying to meet the mental health needs of those young people. And the squeeze on resources, the need for our recognition of our staff, the quality of the contribution we can make, the need for ongoing funding, which we receive from Health Education England for people to complete our 4-year training. So those are the issues that people are coming with.
Yeah, and you mentioned the issues around training funding.
Yes.
That's quite a hot topic at the moment, isn't it? Because of the review that Health Education England announced the last few days.
Yes.
So it's been a great opportunity to speak with trainees about their experiences now and their thoughts of the future.
Yes.
I think we're hoping to do some more work on that over the next few months. So if you are a child psychotherapy trainee, do stay in touch with us, and Julia and Danny, your colleague, would really like to hear from you.
Yes.
In terms of the sessions that we've heard today, which have been the big ones for you? Which ones have you found most interesting?
Do you mean the presentations at the conference? Well, there was a presentation this morning, Dave, where a colleague from Glasgow outlined a tool that can be rolled out across all CAM services and perhaps other services for measuring children's well-being and really illustrating the contribution that child psychotherapists can make, particularly with very, very complex cases where there's been adverse childhood experiences, there's been parental mental health issues, substance abuse, neglect, maltreatment, children in care, learning disabilities, where other professionals who have day-to-day interactions with these children struggle so much to manage their behaviour, to understand their emotional lives. And child psychotherapists can really have a role in helping all the professionals in the network think together and about how to, what's going on inside the child, what the child's trying to communicate through their behaviour, and how to help them and support them. And sometimes that might involve the child psychotherapist actually doing the individual work. Sometimes it's about just bringing the network together and helping everyone think about their experiences of this child, and sometimes the conflicts that can arise between the professionals, and try and understand what's going on with that so that everyone can get on the same page and really meet the needs of the child. And this audit tool that he's developed, this colleague, I think would really kind of help shape that and give a clear message to our managers and commissioners about the work we do.
I think one of the really strong features from the conference, as I've witnessed it over the last few days, has been the use of case studies and child psychotherapists talking about the impacts that they've had on children. I think one of the big things for me has been how complex the cases are that child psychotherapists deal with. And I think it's important in terms of the stuff that we'll be doing, talking to legislators and to senior managers across the NHS, across the 4 countries, that we really get that point across, yes, that this work is complex. And actually it's quite often with children and families who are the most disadvantaged, and it's important that we keep that service there for them. Yes. So that's been a really strong message that I've picked up over the last few days. It's also been really nice because it's actually the 70th anniversary of the association, and it's been nice to kind of share with the celebrations of that. Interestingly, kind of like the mirroring last year's 70th anniversary of the NHS, a profession that's certainly been around for a long time, and certainly, hopefully, with Unite's support, long may that continue.
Thank you, Dave.
So thanks for watching today, and obviously if you want any more details about the work that we're doing for our child psychotherapy members, then Julia and Danny are the people to contact, so do stay in touch with them.